Welcome to the Yellow Spider Media Business Spotlight podcast, a chance for business owners to discuss what they do and what makes them special. Today's guest is Lisa Gregory, Managing Director of Venturi Cardiology. Morning, Lisa. How are you?
Morning, John. I'm good, thanks. Are you?
Yes, very good, thank you. Thanks for coming on and being a guest.
No problem. My pleasure.
Let's get straight into it. You are the Managing Director of Venturi Cardiology. It's a brand new independent cardiology diagnostics clinic in the northwest of England. So can you explain a little bit about what that entails, please?
Yeah, absolutely. You're absolutely right. We're a dedicated cardiology diagnostic clinic. We're consultant-led. So we've got three really experienced consultant cardiologists, and we've got kind of a range of state-of-the-art diagnostics available on site. Lots of heart tests, heart diagnostics, and our own CT scanner.
So in essence, people can come in and check whether there's anything wrong with their heart. Is that right?
Yeah, absolutely. So people can come for screening, preventative cardiology, or if they've got some symptoms that they want checking out, we can do all that at the clinic, yeah.
All important stuff. And rather than be an alternative to the NHS, you're working in collaboration with them, aren't you, to ensure that the patients get the appropriate care?
Yeah, we absolutely, I suppose, want to work with and complement the NHS offering. The consultants and myself, we're all passionate supporters of the NHS, so we do really want to work hand in hand. I suppose what we want is for patients to have really kind of timely access to diagnostics in that really convenient community setting, and hopefully that's what Venturi Cardiology brings to the table.
And that being seen to in a timely manner is really important at the minute, isn't it? Because I presume the waiting lists have gone a bit crazy at the moment.
Yeah, I mean, even pre-COVID, the NHS already struggled with some kind of bottlenecks in some of the specialty services. And obviously the coronavirus pandemic has really exacerbated some of those issues. There was a report that was published earlier this year, in March this year, by the British Heart Foundation, and it had some quite scary headlines, if you like, in terms of access to diagnostics for cardiology. For example, there was 200,000 people waiting for cardiology investigations back in January 2021. 46,000 people had been waiting longer than 18 weeks, and more than 4,000 people had been waiting for over a year. So diagnostic services have been really impacted by the pandemic, and we want to kind of help that NHS reset and recovery piece if we can.
And it's not something you can sort of play by ear, is it? If you've got an issue with your heart, it's generally quite a serious problem. So having to wait any amount of time really is not ideal, to put it bluntly.
Yeah, it's not. I mean, the consultants are all really passionate about kind of timely intervention. So they don't want to see patients on the operating table. They don't want to see them when it's too late to do that good work and that intervention. So by timely access to diagnostics, we can kind of get to the core of the problem. We can understand what's going on with the heart. We can work with the patient to put together a management plan, and hopefully have a really positive impact on somebody's, health and well-being in the long term.
Great. So let's talk in a bit more detail about heart health then.
Yeah.
Obviously, a lot of people will wait until they have serious effects before they go and see a doctor. So without stating the obvious, it's really important to look after your heart and have a healthy heart. But I guess there are some risk factors that you can look out for, aren't there?
Yeah, there are. I mean, a big one is kind of family history. So if you've got a family history of heart disease, whether it's mum, a dad, or a grandparent, then unfortunately your risk of having heart disease increases significantly. Things like you would expect, things like smoking, poor diet, poor lifestyle, and being overweight, all things like that impact your cardiovascular system and put extra pressure and strain on the heart. One of the things that we see increasingly is kind of this sedentary lifestyle that we're all leading now. Certainly during lockdown, we were working from home. I know I myself have a very desk-based job. Sometimes you really have to make the effort to get up and move around. So little things, even if it's just walking the dog for 20 minutes a day, half an hour a day, they can all really benefit your general heart well-being. The consultants actually put together a healthy heart fact sheet, which is on the Venturi Cardiology website. So if any of your listeners are kind of interested in those risk factors and things that they can do to, positively impact those risk factors, hopefully there's lots of useful information in that healthy heart fact sheet.
And there's 2 points there. Just because you have these risk factors, you might smoke, you might have a family member that's struggled before, that doesn't necessarily mean you're going to have heart problems, does it? And then the alternative of that is, if you don't have any of the risk factors, you still might have issues, out of the blue. So what's the best course of action? Is it to come and be checked out by you guys?
Yeah, I mean, kind of preventative screening absolutely plays a part in it. I think the heart is a very kind of complicated piece of equipment that's nicely tucked away inside. So unless you're doing a diagnostic test that's taking a look at what's going on inside, you're right, it's really, really hard to predict. There's a particular test that we do at the clinic, which is called a CT calcium score. So I'm not a cardiologist, so this is a very layman's description of a CT calcium score. But essentially, there's something that's called plaque that builds up within the arteries of the heart. And when that builds up to such a degree, then the consequences of that can be kind of a significant cardiac event, like a heart attack. So by doing a calcium CT score, it gives you a crystal clear image of what's going on inside your heart and your arteries, and it allows a consultant cardiologist to kind of predict your risk factors in terms of your heart health. So one of the surest fine ways of understanding what's going on inside your heart is to have a test like a CT calcium score.
But just so I'm clear though, not everyone would have the calcium test. It's only if it was deemed necessary.
Obviously, it needs to be on the advice of a consultant, so we wouldn't just kind of, pop anyone and everyone on the scanner. It's got to be kind of indicated, and the consultant's got to agree that it's the best thing for you. But yeah, it's quick, it's painless, it doesn't hurt, it doesn't take a great amount of time, and it really is kind of all revealing in terms of what it tells you about your heart health. So yeah, we've got our own CT scanner on site at the clinic in Warrington. So yeah, if anybody was to visit us, that would be one of the diagnostic tests that was available. Yeah.
Let's just quickly walk through the potential route of a patient. So they would come in for diagnostics, and before you stick them straight in the scanner, as you say, they would have a routine checkup with the cardiologist and have a chat first. Is that right? Yeah.
That consultation is really important. I think the heart is really emotive. It's it's kind of the beating core of somebody's body. So often when somebody comes for a consultation, there'll be lots of anxiety, there'll be lots of worry. Usually people come to us either because they've got symptoms that they're worried about and something doesn't feel quite right, or they'll come to us because they feel okay, but maybe they lost a parent, to kind of a cardiac event early. So we've got a lot of patients who've been in contact with us already who've said, you know what, I tried to keep well, I keep healthy, I have a good diet, but my cholesterol's a little bit high, and I'm really worried about my heart health because my mum and dad both had heart attacks in their early 50s, and I'm worried that I could be going down the same route. So sitting down and having that discussion with the consultant is really, really important, because we need to understand what the patient's needs are and what the wants are, and then the consultant will take a really full and comprehensive history, looking at all the medication, lifestyle risk factors, family health. And a Venturi consultation is very much a two-way dialogue between the consultant and the patient. So there's lots of talking from the patient and lots of listening from the consultant, so that they can kind of jointly agree what the next steps are. So that might be diagnostic tests, it might be diet and lifestyle advice, it might be a really conservative management plan, but the consultant and the patient will agree that together and kind of plan all next steps, if that makes sense.
It does indeed, yes. Now, we've mentioned the CT scans and the calcium test, but which other diagnostic tests are available?
We can do all of the tests that you would expect to have access to in an NHS hospital. So we do, we've mentioned the CT scanning, but we do echocardiograms, we do ECGs, we do exercise tests, that full range of diagnostics. Fingers crossed, you're given a clean bill of health and discharge. But if there is further things that are needed by way of kind of intervention, then we would work in kind of conjunction with the people that are part of your treatment plans. So that might be a GP, it might be a consultant at the NHS. If you've got insurance, it might be another provider, but we'd kind of link up and we'd work together.
So very much the first stage in a lengthy process, should it come to that.
Yeah. It's not just about coming into the clinic, us giving you the results and then kind of sending you off on your way and leaving patients to their own devices. We will be as involved as the patient needs and wants us to be in terms of those next steps. So some patients may choose to come back to us for further reviews and checkups. Other patients might want us to send a comprehensive report to their GP so that they can plan with the GP next steps through the NHS. I think it's probably important to say that there's no one size fits all with patients and next steps. Everybody will have an individual set of circumstances, and we'll work with them to make sure that they get the the care and the treatment that they need.
In terms of your career then, have you always worked in healthcare?
Yeah, for my sins always, yeah. So for the last 20 years, really, I've worked in healthcare. So I worked for Bupa for the best part of a decade, and then moved into NHS primary care services. So I started as a GP practice manager and then moved into more senior roles, head of primary care, director of primary care, and kind of, I suppose, saw primary care go full circle. I'm old enough to remember old PCT days, and then evolving clinical commissioning groups, and then fancied a change, and kind of Venturi really is perfect for me. It's really everything that I love, being based at the clinic and being able to kind of interact with patients and their families every day is genuinely a joy. I love to talk and I love to kind of hear stories and chat about the weather and just sit down and have a good natter with them. But then there's the bigger picture, that the most exciting thing is being able to kind of reshape these kind of services and be responsive to patients' needs. So you kind of get the best of all worlds really with this role. And I suppose the added benefit is doing it with a great bunch of people. The consultant cardiologists who founded Venturi are probably the most hardworking and passionate individuals I've ever had the pleasure of working with. Every single one of us is really enthusiastic and really passionate about how we can kind of change cardiology and the way we deliver cardiology services. So it's a great place to be right now.
It's pretty much brand new, isn't it? So have you got any plans to celebrate the new venture, the new business?
Yeah, we have. So our official launch is at the end of June, 28th of June. So we've got a couple of people joining us that we're really, really pleased and proud to be working with. So we've got Dame Lizzie Jones and Gemma Atkinson, who people will probably know from the TV and media. Both ladies, I suppose, passionately champion heart health, work with the British Heart Foundation. They've both had quite significant experiences in terms of the heart and cardiology and the impact that has on kind of them as individuals and their family life. So we're really pleased to be working with them to kind of raise the profile of screening and preventative cardiology and all of that good stuff. So yeah, we're looking forward to welcoming new faces, old faces. Everyone's kind of welcome to pop in and have a look and see what we do.
It's certainly an important message. If anybody wants to know more information about Venturi, where can they find it? What's the website?
Yeah, so probably the website's the best first port of call. So it's venturicardiology.com. So on there'll be lots of information about the consultants. As a patient, it's really important to kind of have a good look at the a good look at the clinic, a good look at the consultants, a good look at the different services and different appointments we offer, so that you can kind of make an informed decision in terms of what you think is best for you. But the telephone number for the clinic is on there. If anybody's got any questions, then drop us a note through the website, pick up the phone and give us a call. We're more than happy to help.
Well, Lisa, thank you very much for coming on the podcast. Like we said, it's a really important message and it's great work that you're doing. Good luck with the official launch. Thank you very much once again for coming on the podcast.
No, thanks, John. Thanks for having me. Nice to speak to you.
Thanks for listening to the Yellow Spider Media Business Spotlight podcast. If you'd like to be a guest on the show, please get in touch at www.yellowspidermedia.com.